Just over 1 million heart patients across the nation have aortic stenosis. For patients at low risk for death or major complications, open heart surgery has been the standard treatment for this disease. However, as our Olivia Leveda reports, the FDA recently approved a new alternative.
Wildlife biologist Dennis Herbert spends a good amount of time outdoors. However, this year his health has made his work a lot more difficult for him.
I had to cancel this year's deer surveys. I could walk across this parking lot, and by the time I got inside, I was huffing and puffing and weak and had to sit down.
A visit from the doctor helped him discover he suffers from aortic stenosis, a narrowing of a heart valve that restricts blood flow to the heart. For patients at low risk for death or major complications, open heart surgery has been the standard treatment.
My only choice would have been open heart. And I've seen my mother go through that, and I've seen heart transplants from people at church. I've seen a lot of different things that, doesn't instill a whole lot of confidence in me having to go through the same thing.
However, the FDA recently approved a new option for patients like Herbert. It's a minimally invasive open heart surgery alternative called transcatheter aortic valve replacement, or TAVR.
This approval is a very exciting time for patients. It will offer patients a lot of opportunity that they've not had in the past. TAVR was originally created for high-risk patients, that is, patients that could not undergo surgery or they were very high risk for undergoing surgery. But we had never previously studied this new technique compared to the gold standard of surgery in a standard low-risk patient. And that's what we did in the PARTNER 3 trial.
Unlike traditional open heart surgery, TAVR allows physicians to deliver the new aortic valve by catheter, usually through a blood vessel in the leg. Herbert calls the procedure a success.
I think I was very fortunate, actually.
And he's ready to get back to work.
I think, this really gives me a kind of a new lease on life and allows me to do that very kind of thing in the future for another 5 years or whatever.
This will open up a lot of opportunity for patients right here in Central Texas.
In Temple, Olivia Leveda, Central Texas News Now.
Herbert had his procedure just last week. He was discharged from the hospital the following day. Researchers say this new approach has decreased complications and shortened recovery time to 1 rather than several days in the hospital.